ADHD is conceived as a neurodevelopmental disorder. We'll get back to that a bit later, but it basically means that it tends to appear and show up, I would say, in childhood, and it stays throughout your whole life. It's comprised essentially of three main components, which are distractibility, impulsivity, and hyperactivity, which are the typical big categories when we're talking about ADHD.
How do symptoms of ADHD differ between children and adults?
I don't think we need to conceive it as something that you catch or some kind of illness. It's something, it's how your brain is wired, basically. So there's many factors playing into it, but basically you're born with it. So the way it shows up, like when we're talking about symptoms and the experience of it, will basically be the same across the whole lifespan. Now, will it manifest the same or be experienced the same throughout life versus when you're a child or when you're an adult? Not necessarily. But if we're thinking about, we just spoke about distractibility, impulsivity, and hyperactivity, I think we can imagine easily that in a school setting, especially how we do schooling now, which is seated at a desk and in the most usual type of school setting, listening to a teacher and being asked to be relatively quiet, that makes it much more difficult for someone who has ADHD. If, as an adult, you are not in a similar environment, you will experience the same symptoms of being distracted, probably have lots of energy, and sometimes being impulsive, but it might be less challenging for you depending on what you do. If you have, I did notice in my own clinical practice that people who do have ADHD but have a very physical type of work where there's a relative amount of liberty in terms of how the body is used, and there's not like a whole lot of attention focusing that's required, then it can make things much easier. Also, the difference at times is that adults can be much more aware of having ADHD, and when they are, they can accommodate for it.
Are there differences in how ADHD presents in males versus females?
There tends to be differences. I'd like to say now that ADHD can be seen also on some form of spectrum, so the presentation is not exactly the same in everyone, but there are big tendencies that tend to be observed. So if we go back again to those three kind of like pillars, let's say, of what ADHD is about, distractibility, impulsivity, and hyperactivity, boys will tend to be more hyperactive and impulsive, while girls will be more inattentive. Again, tendencies, you can absolutely have hyperactive, impulsive young girls, as you can have very quiet, mainly inattentive young boys. But the tendencies usually, and we kind of see that, like it's easily imaginable. We see young boys being like rambunctious, moving a lot and being really hyper, and young girls being a bit more distracted, more in their, like daydreaming, basically. Like we pick it up more easily with boys because of how it shows up. If you're hyperactive and impulsive in a classroom, for example, or even at home, it moves a lot of energy. Someone who's quietly drawing and singing a song in their head, not as much. So it tends to be picked up earlier and better because the behavior in boys is more disruptive, and it tends to be perhaps not detected as easily or as soon in young girls because it doesn't show in such an evident way.
How early in life can symptoms of ADHD typically be identified?
It's quite early on. I think that starting school, like elementary school, is a big marker because, again, to pick up on ADHD, you need an environment that challenges that person. So a toddler, for example, we are expecting that they're moving around. Of course, every child has their own temperament. Nobody's exactly the same in how they present, but it will start to appear more clearly when there are challenges for that specific child. And for example, an environment that suddenly reveals a difficulty that someone who doesn't have ADHD will not have by then. If we're looking at formal diagnostic criteria, it needs to have appeared before the age of 12, normally to be considered ADHD. But again, this is not necessarily something that changes over time. Like, the core of this is understood as being a stable thing throughout the lifespan. How a specific person addresses it and how they experience it might change a bit, but the core difficulty, let's say, and we'll go back to that because ADHD is not just, there's a part of me that doesn't like that we call it a disorder. The disorder part speaks of course, the challenges that come with that. But there's more and more perspectives that see this, because it's part of a larger ensemble of ways that our brains can be connected, that's referred to as neurodivergence, meaning it's not wired exactly in the same as the vast majority of human beings. But it doesn't just come with challenges, difficulties, and problems. It also comes with a bunch of gifts. So yes, you can be distractible, but people who have ADHD tend to be extremely curious people that need intellectual stimulation, and they crave everything that they see around them to learn about the world. They can be impulsive, sure, but it also means that they come with an extraordinary amount of energy. You often see people who have ADHD, they're not just like people who are constantly distracted. They'll know moments of what we call hyperfocus. If they're really into something, then all of a sudden everything can be focused on that thing for a long amount of time. So it's really kind of a way of being that is filled with these high contrasts.
What behaviors might be mistaken for ADHD but are caused by other conditions?
People who are going through a higher level of anxiety, of course, you won't be as able to focus your attention on something in a sustained way because you've got other things circling in your brain, other things that are worrisome, that you're trying to process and constantly thinking about. So understandably, it takes away from your ability to focus, let's say, on a task at work, a conversation with a friend or a colleague or family. And it's different than ADHD in the sense that it's clearly that anxiety that takes away from attentional resources. Someone who has ADHD can be inattentive even when they're not anxious. And of course, people with ADHD can also experience anxiety, and it makes things a bit even more difficult in terms of maintaining attention. We can say the same about depression. If you are stuck feeling really, really bad about yourself, you're criticizing yourself, you feel guilty, you feel like your mood is really collapsed. Understandably, it's also a component of depression to have difficulty with thinking and maintaining your attention and focusing. So, and again, someone who has ADHD can absolutely also be depressed, and that makes things even more difficult. But someone who has ADHD would still be distracted even when their mood is uplifted or good or normal. Trauma I would associate with, like, trauma very often gets expressed through experiences of anxiety and depression. So if you're triggered by something, I triple dare you to be able to focus on anything else, because your brain is at that time in a fight or flight or freeze mode, which makes it impossible to focus on something other than what has been perceived as a danger at the time. So if you had to focus on something in class or something that a colleague is telling you and you get triggered, you can't keep up with whatever was being addressed, because all of a sudden your brain is in survival mode and mobilizes everything it's got to make sure you're safe, not to follow necessarily what's happening in that conversation or that class or whatever the environment is. And hearing impairments, I'm not an expert of that, but intuitively, just from hearing about it, well, yeah, like if a child doesn't hear well, for example, or even an adult, it could masquerade as like, well, I call him by his name, but they must be so distracted. well, no, let's check up like those things. And this is part, and we're going to get back to that a bit later, but when we are assessing to see, is this ADHD, these are the kind of things that need to be properly assessed and understood so that we're not making a mistake in terms of what is really causing the difficulties.
Do ADHD symptoms change or evolve with age?
Understandably, as you're aging, your level of physical hyperactivity might come down as your energy reserves are kind of like lowered in a way. But what tends to remain is a high level of mental activity. So people who have ADHD, even though through aging, even though, they might get a bit more tired, they still need to be highly stimulated mentally. They will still have high imagination and need to feed that. But it's not uncommon to see people who have ADHD to be, if not athletes, but to still have that need to move a lot. Their peers of the same age might have stopped like cross-country skiing, but they'll happily be still on the paths doing that.
How can someone distinguish between typical behavior and signs of ADHD, especially in children?
Typically, boys will express, and it's through socialization, so how we bring them up. They can tend to be more physical, so it's not automatically when a child moves a lot that it's, oh yeah, that's hyperactivity. I would be tempted to think that hyperactivity is really when they can't prevent themselves from doing that, and that it's present at high volumes, much more than some of their peers. If we put them on a spectrum, you have people that will present. Someone who has ADHD would be kind of one of the most extreme presentations on that same spectrum. It comes with a bunch of things, and it appears in a very marked way. So, for example, you have children and adults, if they are hyperactive, there's that sense of them being driven by a motor. They need to go. And there's not much modulating that. The idea is not to try and prevent them from doing that, telling a kid or an adult to quiet down and to stop. They'll need to, so that's when you start to see the fidgeting, the tapping. That energy needs to come out. And it's much better to have means to see this seen to. I've seen children in classrooms, if they're provided with the proper tools to accommodate for the higher level of energy they have, for example, those little bike pedals under the desk, and it can change the picture from night to day. And it's a night and day difference, because it's not about controlling that, it's about giving a proper channel to it. So it's adapting as much as we can, adapting the environment to suit the need of the child there. Because again, the disorder aspect of it comes not from something that's inherent to how the brain is wired. It's not in the absolute that ADHD is a disorder. It becomes a disorder or a challenge when it's matched with an environment that doesn't fit well. Just with the characteristics that I've presented so far, I think it's easy to see that people with ADHD often become entrepreneurs because they have all of that drive, yet they don't function super well in a very regimented type of workplace. So working a 9 to 4 or 9 to 5 for them might be very, very hard. But if they can drive their own business and their own thing, it might be even more work hours per week. But if they have the choice of how they do that, if they can pace around, if they can run on a treadmill while they do their things, then it's going to work. So it's really about trying to find an environment that can fit. And later, I think we're going to brush up on the question of medication, because sometimes the environment cannot be changed. It's hard to change a whole school structure, especially in a short amount of time, to accommodate kids who present with a high degree, let's say, of ADHD. And some of that can be compensated. If you're stuck in an environment and you have no choice but to evolve in an environment that's not very adapted to how your brain is wired, then that's one of the ways in which we can reduce that mismatch.
Is it true that ADHD is overdiagnosed, especially in children?
I think for all of neurodiversity, but also for mental wellness, I've personally seen on social media how there's kind of a democratization of the knowledge around that. So a lot of people are sharing information about these different ways of being, or these different these different types of challenges. So if people are more aware, therefore they're probably more able to ask, to get an assessment, for example, or to recognize in themselves to begin with, hey, wait a minute, that really looks like me. More knowledge, therefore more awareness, and therefore more detection, for a lack of a better word. There's also the result, like some people think, some doctors, some researchers think that there's more people presenting with attentional difficulties because of the world we live in. I've just mentioned social media. Platforms like TikTok made popular this quick switch between highly stimulating short bursts of video content. So it's very rich, yet you switch through those videos and you keep like being stimulated like that. We also live, so there's a lot of stimulation that comes our way. We also live in a world where we are under pressure. We live in a performance-oriented world, and we live in a world where that is extremely information-rich. In many of the jobs that exist here at KSCS, we have just managing our emails is like it's a big amount of information that comes from so many different ways. And so there's an understanding that some people might feel that they have ADHD. Is it ADHD? Perhaps, but it's also possible that it might be some other point on that spectrum of attentional difficulties, that maybe your brain is not necessarily wired like that, but anybody that you put in an environment where it's like too stimulating, there's too much information, understandably, you're going to be distracted, because you can't keep focusing on one single thing when you're being bombarded left and right by all of this stimulating content. If I look at TikTok, for example, like it's just the flick of a finger and I get something new. How can I focus on, if I was thinking about something coming from the previous video I was checking, how can I focus on that when I have this new, highly stimulating new content that comes through my eyes? It's very difficult.
Is ADHD just a lack of discipline and or poor parenting?
Someone who has ADHD literally doesn't have a brain that is capable of as much focused attention than someone who is more neuro-normal, in the sense that their brains is wired like the vast majority of people. So it is not a lack of discipline. Being distracted is not the product of laziness. And again, I'm going back to what I was mentioning earlier. The same children can also, and adults can also know moments of high hyperfocus. So typically, people like that might have the hardest time getting to a task, and then they complete it in 15 minutes once they get to it. So it's a different way of processing information. And so if you're forced into a model where you need to produce an answer fast or within a short amount of time or within that exact time, much more difficult for someone, or it can potentially be much more difficult for someone who has ADHD by comparison to someone who doesn't have ADHD. But the flip side of that is the person who has ADHD, when they get to that space, and there's different ways to kind of facilitate that, then they can really create something that can be highly original in a shorter amount of time. But in essence, it's kind of balanced, and we all have different ways of showing up.
Is ADHD a result of too much screen time or sugar consumption?
No, it's also not the result of that, although too much screen time, too much sugar can certainly exacerbate that. If you eat too much sugar, we notice it in children, but I would also qualify for that. Like, I'll be quite hyper for a little while, like it's gonna spike in my bloodstream and I'll have like more immediately available energy. If I have too much screen time, you can bet I'm gonna have a harder time if I'm to switch. Let's say I'm looking at TikTok, or its equivalent on Instagram and Facebook, and then I want to switch to like painting watercolors Ooh, that gear change will be a bit difficult because these are two things that are very different in terms of their pacing. We're talking about like quick, constant stimulation to something that requires like a much different pace that is equally satisfying, but in a different way. It takes much more time. If, let's say I'm starting to paint before I get, it's not the same kind of like instant gratification yet, and that also could be an interesting topic in and on itself, but some people argue that we need to have a good balance in between. It's not necessarily an evil thing to have like cheap thrills and like things that come in like super quick, but I do think that it's good to balance it out with things that we put sustained effort and lead to a more profound, enduring sense of satisfaction, like for example, artistic pursuits, painting, playing music. Because otherwise, I think that too much of the quick stuff makes us, and I don't know, perhaps you've observed that in your own experience as well. In mine, if I overdo it, I become grumpy. I become kind of, it's as if that dopamine was depleted in my brain, and it's harder to feel that sense of satisfaction. Just as when you eat too many candies, eventually sugar doesn't do anything for you because you're kind of like saturated. So I think that balance is essential. But for a kid or an adult who has ADHD, if you add those components, I think it increases the challenge. But it's not a cause. It's not a causal factor. It's something that could make things worse.
Do all people with ADHD have hyperactivity?
We're all different. Nobody's the same. And even when you look at people who have received a diagnosis of ADHD, their presentation varies from one person to the next. Some people are present much more with the hyperactive, impulsive aspect. Some people don't have it, yet they have like the inattentive aspect of it much more, and that is more present.
Is medication the best treatment for ADHD?
Medication can absolutely be a good treatment. Is it the only treatment or the best treatment? Not necessarily. It always depends on the presentation, where the person is at. If you're in a work that you love, yet the requirements of that work cannot be changed for a bunch of reasons, then medication can be adapted. Let's say children in school, super hyperactive, super impulsive, super inattentive, and they already like do all the sports they can. They already have like all the supports they can have, accommodations from school, etc. And it's still very present. Then maybe in a situation like that, I could somehow compare it to people who will take antidepressants, for example. Are antidepressants absolutely necessary to come out of a depressive episode or go through a period of heightened anxiety? Absolutely necessary? Not necessarily. Can they help? Absolutely. But it depends on the picture, what the person is suffering from, the intensity of that suffering, and if other means of helping, do they work or not in some situation. And sometimes a mix of everything is the best scenario.
Can someone grow out of ADHD, or is it lifelong?
It's definitely lifelong. It's the way your brain is wired, so you cannot outgrow it. It's not something where, some things we hear like, oh, yes, they will grow out of it, or the nervous system will mature, or different aspects of the body will mature, and it can change. Not with ADHD. What tends to change is, again, type of environment you are in and the type of adaptations that you might have been able to develop. How many resources are accessible to you? Sometimes, not always. As an adult, you might have access to more. And as a child, if you're well surrounded, well supported, you could also have a bunch of support. So it's always going to be there. Your environment will change. I do, like in my own, again, I'll go back to my clinical experience. I've seen people with ADHD make decisions in terms of sometimes they didn't even know yet that they had that, but it did guide their choices. They knew that being in an environment that requires a lot of like focused attention was not just for them. It was just not for them. Like it was too hard for them, and the fact that it was hard also made it absolutely not fun. So they chose different types of settings. And by this, I certainly don't mean that school is not a good option for someone who would receive a diagnosis of ADHD. School can be absolutely very stimulating intellectually, for example. Does it mean that it would require some accommodations through like IEPs? Yes, and if that is possible, then by all means. Because again, it's about matching that environment as best as you can with how your brain is wired and how you are, and what kind of gifts versus what kind of challenges you have.
What criteria are used to diagnose ADHD according to the Diagnostic and Statistical Manual of Mental Disorders?
You need to have at least 6 criteria in the inattention symptoms and or in the hyperactive impulsive symptoms. So someone who would have only the inattentive presentation would still need to have 6 of the criteria, and I can read them. Maybe people can like identify with that and recognize themselves into that. And it needs to be at least for 6 months. First one is often fails to give close attention to details or makes careless mistakes in schoolwork. Often has difficulty sustaining attention in tasks or play activities. That's number 2. Number 3, often does not seem to listen when spoken to directly. So hence the differentiation with potential like auditory difficulties. Number 4, often does not follow through on instructions or fails to finish schoolwork. You can hear in the criteria that there's a lot of like school, but this applies to work as well in adulthood. Number 5, often has difficulty organizing tasks and activities. Number 6, often avoids, dislikes, or reluctantly engages in tasks requiring sustained mental effort. Number 7, often loses things necessary for activities. For example, school assignments, pencils, books. It could be tools, it could be laptops, it could be books. Number 8, often is distracted by extraneous stimuli. What beautiful words. So external stimuli. Look, a squirrel, like that kind of thing. Number 9, often is forgetful in daily activities. So that's the inattention symptoms. If you look at the hyperactive impulsive symptoms, again, at least 6. Number 1 is often fidgets with hands or feet or squirms in seat. Often leaves, that's number 2, seat in classroom when remaining seated is expected. That applies for a desk job as well. Number 3, often runs about or climbs excessively in situations where it is inappropriate. I'd like to see that in a desk job type of environment. Number 4, but you see people, some colleagues you have are always on their feet. It's as if they had a spring back there, and like as soon as there's something they can do and get up, like you'll notice that. Often has difficulty playing or engaging in leisure activities quietly. There might be a lot of humming, singing, the tone of the voice might be elevated. Number 5, often is on the go or often acts, so that's the one I was mentioning earlier, as if driven by a motor. So there's a feeling of that level of drive, like it's very apparent. Number 6, often talks excessively. So again, there's this richness, right, in terms of the volume in terms of intensity, like how loud they are, but you'll have kids, especially, and even adults, that you go on a hike with them, and from the bottom of the mountain to the top of the mountain, back to the bottom of the mountain, they're going to tell you everything that, that comes to their minds. Number 7, often blurts out answers to questions before the questions have been completed. That goes very well with number 8, often has difficulty awaiting turn. And number 9, often interrupts or intrudes on others. Well, that speaks of the same thing, butts into conversations, or you'll see kids just jumping into a game without respecting kind of the decorum around that. The other aspects to that, to the diagnosis, according to the DSM being that manual used by doctors to conclude on a diagnosis, is that it needs to create a significant amount of impairment. So if that is all present, it also needs to create a problem to the person. Otherwise, it doesn't necessarily leads to a diagnosis. It's the same thing for pretty much every diagnosis in the DSM. It needs to be invasive enough and to cause significant problems. So if all of this somehow didn't interfere with your social functioning, work functioning, school functioning, you can't conclude to a diagnosis. So it goes back to that notion of fit between the individual, how they're wired, and their environment. They might present with all of this, but you can't get a diagnosis of ADHD if, let's say, the world was perfectly made for you. Then how could we call that a disorder? Because you'd be all right. So, but unfortunately, it does come across as presenting with important challenges because the world is not necessarily built around people who have a brain that is wired this way.
What role do psychological assessments or neuropsychological testing play in ADHD diagnosis?
There is this belief that is shared even in the medical profession that a neuropsychological assessment is always necessary to reach a diagnosis of ADHD. If you look at the current most up-to-date guidelines, Canadian guidelines on the diagnosis of ADHD, you do not need to be assessed by a neuropsychologist. One obstacle of that is the length and the cost of these assessments. Normally, the people who are able to diagnose, that would be doctors, medical doctors, including psychiatrists, but also your GP, and psychologists. We have that right and that competency to assess for that and to provide a diagnosis if it fits with the criteria. So neuropsychological assessments can be useful, but the ideal practice around them for ADHD diagnosis is when the situation is extra complex. Let's say the person has a lot of anxiety, is going through a lot of difficulties in terms of their mental wellness. They might have like accompanying developmental trauma, perhaps other delays or difficulties, and we're trying to figure out what is what. Then a neuropsychological assessment can help sort through that. But for most people, this is overkill. Like, you don't need to go to that extent. Some medical doctors, some psychologists are not necessarily comfortable or feel that they've been properly trained to do that assessment. But those who do can absolutely do it through clinical interviewing. There's also some interesting tools that can be used. For example, there's the ASRS, which stands for, I can't remember, but it is a screening tool for ADHD. It can be found for free on the web. And it can, again, it is not a diagnostic tool, it is a screening tool. What a screening tool does is that it tells you if it's really not that or if it's potentially that. And so if you fill the ASRS and you score highly on it, basically the ASRS is based on the symptoms that we've read, the criteria that we've read from the DSM. If you score highly on that, it's therefore highly likely that you have ADHD. The next step after that would be to ask your GP, or if you have access to a psychologist, for further assessment of that. And then it can unlock the benefits of having a diagnosis of ADHD is that, let's say you're in school, well, you can have access to extra services and accommodations, for example, having more time for an exam and so on. It can also allow a doctor to prescribe medication should that be something that's necessary and helpful in a given case. That's the advantage of and the reasoning behind having the diagnosis. It can be useful to fill a screening tool prior to asking your medical professional for more information, because it already gives them a picture. And I know that a lot of medical professionals and psychologists use that screening tool. And then if you complement that, let's say you did it before, and you complement that with clinical interviewing. So I meet with someone, for example, and we talk about what they're going through, and then it allows me to see, does it fit with those diagnostic criteria? And if it does, then I can conclude to a diagnosis.
How do you ensure an accurate ADHD diagnosis when symptoms overlap with other mental health issues?
If you're anxious, if you're depressed, if you're triggered, like all of this can create problems with your level of energy and your capacity to focus and sustain your attention. I'd be tempted to think that perhaps one of the best ways, one of the things that come to mind is the duration. Usually, some people struggle with that for a longer period of time, but feeling lots of anxiety can last for a few weeks, a few months. Is it going to be a lifelong thing though? Not necessarily. Same thing with depression, same thing with being into trauma. It can show up here and there, but to distinguish between that and ADHD, someone with ADHD permanently has potential challenges with distraction, high energy, like in hyperactivity and impulsiveness, depending on their presentation. So it's not something that tends to show up. Like in my own experience, what I tend to see in clients that come and ask for my help, they're going through something that makes them experience something that's really difficult. For example, it's going to be felt as anxiety, for example. We work on that, and then it resolves. If someone had ADHD and came in because they felt anxious, that happens too. Those difficulties with attention, they were very present before they started being anxious. And when they stopped being as anxious as they were when they started consulting me, they still have difficulties with attention. So it's really something that stays stable. We could ask ourselves the question while during the work with that person, how do you sort what's what? Well, you could ask questions about how it was before that person started to experience anxiety. You could ask questions about, especially if it's an adult, when they were children, how was that? And if it's something that's a sustained pattern and they're not just fidgeting today because they're near a panic attack, then it's more likely that it might be something that is ADHD.
What is the difference between being easily distracted and having ADHD?
A lot of people, vast majority maybe of people who have ADHD, aside maybe for people who only have hyperactivity and impulsiveness, will tend to be easily distracted. All the while, everybody who is easily distracted doesn't necessarily have ADHD. So it is one component of ADHD, like we talked about today. But for it to be ADHD, it needs to be more than that. It needs to come, if we go back to all of these criteria that we've seen, it needs to be quite significant, quite present, enduring in time, more than 6 months, and lead to challenges. So if I'm easily distractible, it might not necessarily lead to challenges in my school, in my work, in my social life. But if it systematically does, then it's more likely that it's a component of ADHD.
From your professional experience, is there any information you would like to add regarding ADHD?
There's one thing that's really dear to my heart in this, because I remember when I got trained and when I went to university, ADHD was always presented as a disorder because we learned from the lens of the DSM, which looks at things from the angle of how challenging it can be to present this way. And understandably, it's looking with the lens of what is the problem. But ADHD is much larger than that, and there's more and more of a perspective that is neurodivergent positive, let's say, meaning that we can see people who present this way not necessarily as having a disorder, but being different. And again, I must insist that I'm not denying the potential problems that come with having a brain wired like that. But it's also very useful to look at the gifts that come with that. And I think that this is one of the beautiful things that is happening with the democratization of knowledge around mental wellness and neurodivergence, is that there's a valuing of it by people who recognize their peers that are similar, and there's kind of a shift from just seeing it as something that's kind of like an illness or a disorder to something that, yes, comes with some challenges, but who doesn't have challenges? But also comes with these gifts of high curiosity, intensity, curiosity, hyper-focus, and inordinate capacity to be extra productive and creative at times. Not everybody works like that. Other people have gifts somewhere else, but people with ADHD that I know tend to present as such. So it's not all doom and gloom. There's also a lot of sunlight, and sometimes it burns particularly bright.
I suspect I may have ADHD, or my child may have ADHD. What should I do?
It is not true that a lengthy, super expensive assessment is needed to get to a diagnosis of ADHD, unless the situation is extra complicated and the puzzle doesn't have 100 pieces, it has 10,000. Then you might need something a bit more that goes a bit more in depth. But for the majority of people, you can start by, like we said earlier, using a self-screening tool. The ASRS has good properties to it. It's a high-quality screening test. You can then ask your GP for them to assess you, because they are capable and it's part of what they can do. Whether they feel competent about it or confident, I should say, about it, that's something else, but they have the ability to. And the other path can be through consulting with a psychologist. So that's part of what KSCS can do. If you strongly suspect that you or your child or a child you know has ADHD, a request can be made with KSCS. And in that case, it would most likely, for adults, it would most likely be me or my colleague that's also a psychologist that could offer a brief assessment, a few sessions to get a better sense of who that person is, what their challenges are, and does it fit with the criteria that are necessary to reach a diagnosis. Sometimes too, we might also take the time to have a conversation on the reason behind wanting to have the diagnosis. Sometimes when it opens doors, for example, for children, if it leads to an IEP, but even for an adult, it could lead to a doctor being a bit more comfortable with prescribing medication in some cases. Or I don't know about accommodations with work, that I'm not sure. And it can also be a way, because I've seen in some people that it can really change the perspective on yourself. Some people have been told during their lifetime, that they were anxious. How are you always so hyper? How are you always so sensitive, so impatient? Why do you ask the question why all of the time? And so they kind of seen themselves as being annoying and highly anxious people. Once they understood that it was ADHD, it completely shifted the perspective. And once they understood their needs better, that yes, they need all of that stimulation. Yes, they come with some kind of heightened sensitivity to this life. And yes, it's not being hyper or too much. You can only be hyper or too much for someone else. So if you see to what you need, then, oh, look at that, you're not anxious anymore, because you see to your own needs, and that's how you take care of yourself. So it can really change a whole perspective. And I would say that the change of perspective in and on itself can also diminish that anxiety, because you stop seeing yourself as being dysfunctional or inadequate. You understand that your brain might be wired a bit differently, and that what sees to the needs of a lot of your friends, well, it's not for nothing that it doesn't see to yours. You might be built a bit differently and need something that's a bit different. And once you start understanding that, it can unlock a bunch of things and reduce the amount of pain you're going through.